Dizinaseguja. My name is Joel Fisher. I'm a nurse with the Sept Health Center, and this is a message about the new bivalent vaccine that will be available to all nation members next week. So just so everyone is aware, it has been announced by the province that starting tomorrow, Alberta is able to start ordering and distributing the bivalent COVID-19 booster shot. So the health center has been getting prepared, putting an order in, and we will have our very first clinic with the new vaccine this Tuesday, September 27th, 2002. So the same day as the pediatric Pfizer clinics that we have. Pediatric clinic will be different than the new bivalent vaccine. The bivalent vaccine is for those who are 18 and older. All nation members who are 18 and older and have had at least 2 doses of the vaccine, or you're on to getting booster doses. So that first 2 doses is just the full kind of initial shot you have to have done. After that, any of your booster shots that you're eligible for can be the new bivalent vaccine. And for anyone who is a home care client, the home care team will be connecting with you directly to help make sure that you get that shot should you so choose. Anyone who is looking to book or has any questions in particular about the new vaccine, please feel free to call the Health Center at 403-251-7575. Now, for those of you who are curious, what is a bivalent vaccine? Bivalent just means that there's 2 different vaccine mRNA indicators that are in that vaccine for our body to recognize. This is very common. We may have told you about quadrivalent vaccines before. That's pretty common for flu shots, and it means there's 4 different vaccines. Bi means 2, so there's bivalent is this one. In this particular vaccine, it's still an mRNA type vaccine, and what it contains is half of the vaccine is the original vaccine that you've been getting or have had booster shots of, and the other half is the new vaccine that's based specifically off the Omicron variants that we have seen. This is to help increase protection. If you're vaccinated, it also decreases the likelihood that you can transmit to somebody else, and it significantly decreases severe cases. So the likelihood of ending up in hospital is very, very low once you've had all of the vaccines and the boosters in particular. Just as a quick reminder, mRNA vaccines, the way that they work is it's just a small portion of a protein, and it's just put into kind of a fat cell almost within the vaccine. And our body, the white blood cells, will take a look at that, and it basically provides a blueprint of how they need to fight off whatever this vaccine is, or whatever the virus is. So they're able to recognize the virus and fight it off quickly so that you don't get as sick and you're less likely to transmit it to somebody else. Once your body has had the chance to kind of see this little mRNA, it destroys it, gets rid of it through your lymph system, just like anything else that your immune system is dealing with. So just as a reminder, it's just a blueprint for your body to look at, and it basically, every cell has these little proteins on the outside, kind of like wearing a hat, and it lets our white blood cells, or those that fight off the bad infections, to see what that cell is by recognizing the hat it's wearing, and it can then attack that virus. So some of the side effects, as with the last vaccine, very, very similar. There's kind of those first 2 days where most people see the regular side effects. So pain, redness, swelling at the site, fever or chills, fatigue, headaches, dizziness. Now, most of these side effects are actually the body and how our body reacts to infections and our immune system works. So it's not necessarily even the vaccine, it's how our body reacts to the vaccine while it's building that immunity up that we get a lot of those symptoms. They should only last about 2 days before subsiding. And in very, very rare and severe cases, there is the severe anaphylactic reactions or a severe allergy or the potential for facial paralysis, like the partial facial paralysis, or some swelling of the heart muscle. Now, all of these are the same from the previous vaccine, incredibly low risk. And in the cases on the new vaccine, there weren't actually any of these symptoms found, but on a larger sample size, it is still a potential. As a reminder, if you've had the other vaccines and this wasn't a problem, the likelihood is still incredibly low, very safe to get the vaccine. So anyone who would like to get the vaccine and is going to call in, Just so you know, it should be 5 months after your last booster dose or 5 months after your last infection with COVID-19. Now, the reason for this is just so that you have the best immune response possible and that your body is able to build up a good amount of immunity to last you for much longer, so that that waning period doesn't happen as quickly. And if there's anyone who is concerned maybe about that 5-month time period, if you are high risk of getting infected or if you have some health concerns, please call in. There is potential for that shift to be about 3 months once talking with the team and with your doctor. Should you have any other questions at all, concerns about if you are eligible for the vaccine or if it is safe for you, please feel free to reach out to your doctor to have a conversation with them about whether or not this is a good choice for you and if it's safe for you to get. For those of you who have already received boosters and are waiting for news on this new one, this is a great time to go ahead and book for that bivalent vaccine before we move into flu season. So with flu season coming up, making sure that you've got really strong protection already on board is great. And then just as another reminder, the flu shot will be coming up kind of later in October. We should be hearing about that. Flu shot is different than the COVID shot, and absolutely you should get both of those for the exact same reasons. It'll help during the flu season to prevent you from catching the flu. If you do catch it, you'll get healthy faster and be less likely to transmit that off to somebody else. So just a reminder about all of the different vaccines that'll be coming out in the next few months. We ask everyone to just keep watching anything coming up from the health center or emails that are going out. And we look forward to seeing you at our clinics. See you, Gus.